Good afternoon, everyone. My name's Alice Turner. I'm a Professor of Respiratory Medicine at the University of Birmingham. And I'm just going to tell you a little bit today about the respiratory medicine course that we run. If the slides will advance, of course. Okay, so this is your basic course structure. It's a modular course, so you can register as a postgraduate certificate or a postgraduate diploma or a master's, and you can build from one to the next. So you could hypothetically register for a postgraduate certificate initially, graduate from that, and then add extra modules in a future year to progress upwards to diploma or master's. And this is a relatively common way of doing it, particularly for people who are, for example, already working and maybe want to do this alongside a job. At all levels, whether it's PG Cert or above, you have to do the two core modules, which we call respiratory medicine in the community and respiratory medicine in secondary care. And those count for 20 credits each. The number of credits that then have to be gained to work up towards the next level are 20 credits for a postgraduate certificate, 80 credits for postgraduate diploma and masters. The majority of the optional modules that you can choose from are 20 credits each. So this means that usually you do 1 for a postgraduate certificate and 4 for the masters. And there's quite a broad range of these. So you can choose from some basic science ones, you can choose from some epidemiology and research methods, and other things that follow up on specific interests. So for example, clinical trials, certain aspects of cancer biology or infection. And we're quite flexible and would encourage you, if you do see a module that's not specifically named as one that we take as an optional, just ask us about it. There may be a way for you to be able to follow up your interests. Important things to think about when choosing the optional modules are how that will fit into your chosen master's project if you're going on to do the master's. So the master's is a project that is usually conducted within the later part of the year. But if it involves certain research methods, as most of them will, then it's important that you've gained the skills to do your master's project. And which modules you choose will help us in allocating which master's project that you do. And we provide a menu of different research projects to be done during the master's, but it may be possible to design your own project. You just need to make sure you talk to us as module leads about what you might want to do. So who do we have doing our course? We do have an international intake. So we've got a number of students from the Middle East and from South Asia this year. But we have a mixture. We take students from all over. We do have a fair few healthcare professionals, not just from within the UK, where we've had people who are general practitioners, advanced care practitioners, ACPs, nurses and physiotherapists. But we also take people directly out of other university courses. So for example, we've had people who've done pharmacy courses or pharmacology courses who've then come on to do this as a master's that will kind of guide them more, I guess, towards the job market afterwards. And we'll talk at different points through the course of careers that the course might lead towards. This is a rough outline of what the course structure looks like. In semester 1, which is from roughly speaking September through to January, you will focus on the core module of community respiratory medicine in the community. And then the optional modules that you choose will be dependent whether or not you're doing any this semester or next. It is, of course, sensible to try and choose your optional modules so that they're spread out around the year and not so that they're all lumped up together up front. We also have clinical sessions allied to both of the core modules. And generally speaking, those will start around November time, just to give you time to settle into the course, pick the type of sessions that you might want to do and target those to the assignments and assessments that comprise the two core modules. In addition, at the beginning of the semester, you'll be presented with the master's choices, and you'll be asked to rank which ones you would like to do as your first, second and third choices. Some people start to do reading about the background towards their specific master's project during semester 1, but this is really quite student dependent, and whether you choose to do that will probably depend on how closely the master's project you choose allies to your background. We also have a range of formative assessments, and we've put a couple of these, 2 to 3 generally. The plan you have here has 3, but some years we've had 2, some years we've moved the third formative into the early part of semester 2. Just depends really on how the examiner's availability is. And the purpose of these is to try and give you the skills to be able to pass your summative assessments in a more smooth way. So we can give you the skills early on to say, well, you know, you're not doing this quite right, or you're not doing that quite right, or actually you've already got it sussed, and so you're good to go. The Christmas vacation comes technically in the middle of semester 1, and then the assessment period comes after that, generally speaking, in the first couple of weeks of the January term. It's important to recognise the university also have specific assessment support weeks, and we align to all of those. And so where assessment support is offered by the university centrally, generally in the last week before Christmas, then we will also have some sessions aligned to that. In semester 2, the core module of secondary care, so respiratory medicine in secondary care, occurs. And then you also have ongoing optional modules depending on what you've chosen. For most people, they will get most of their clinics done during semester 1, but you are allowed to continue your clinics throughout semester 2, all the way up to the Easter vacation that you can see marked in the second black block on this slide. Most people will usually start to do their master's projects during semester 2, and that's in part because there is a formative assessment that always occurs to give a project outline partway through February. And when you hand in that master's project outline, that enables us to give you some feedback on whether your project is going in the right direction, and maybe align any additional clinics or teaching support that you need to the project that you've chosen. There's a written assignment for this, which is focused on clinical service development and quality improvement. And the reason we've chosen that as a means of assessment is to make it very different from the one that occurs in the other core module. And that's to give you a range of skills that will be applicable to the job market later on. We'll come to that in a future slide. Here you can also see revision periods after Easter and an exam period in the summer marked. And it's important to note that the exams that you get in the summer period relate to any work that is done in semester 2, and the exam period in January, alluded to on the previous slide, will cover any work that was done during semester 1. After the exam period is over in the summer, the master's work really begins in earnest. And this is generally through the whole of June, July and August, with a handing in of the projects towards the end of August. And during this period, you should expect to have some small peer group support sessions, working with other students on the master's course, and meeting with tutors just to kind of troubleshoot things, in addition to meeting with your supervisor for your master's project. In terms of how the course is taught, as with all university teaching at Birmingham, we are a COVID-safe campus and course, and we have been this year mainly face-to-face lectures. The only limitations that have occurred in face-to-face teaching have been when there's insufficient room space on campus for us to be able to accommodate students safely. So I would say that 95% of our teaching for the core content has been face-to-face, with occasional lectures done over Zoom, where we've not been able to get a room that fitted in with everybody's availability. Where we have had priority needed to be given, we've given that to practical and clinical sessions. So for example, when we've been teaching people how to use ventilators, that's quite a hands-on task, and that would be almost impossible to do in a video-based environment. And so we would always get people in to do that. And for each of our lectures and small group teaching sessions, we record them when we conduct them in person, to make sure that if a student has missed it for whatever reason, so for example, if there was a clash between a core module and an optional module, that they can actually catch up on that learning afterwards via the virtual learning environment, or VLE. And on the previous slide, I did mention about clinical sessions. These are always face-to-face in a hospital or GP practice environment. And we recommend 6 of these at a minimum. At the beginning of semester 1, there will be a menu of different sessions released to students with a list of learning outcomes from those clinical sessions. And you can then pick from those according to which you think will be most interesting for you. It's then your responsibility to book yourselves into those sessions with the allotted clinical supervisors and to record your attendance at those. And we will give advice at the beginning of the course as to how you might choose these clinical sessions and why you might choose particular ones. Because of the way the assignment structure is made, the community module being in semester 1 with its assessment at the end of semester 1 in January often means that the clinical sessions are front loaded towards passing that community assignment, which requires the gathering of clinical cases. For students who are not working alongside the course, the sessions are therefore vital to be able to gather cases that they can talk about. And this sort of focus on cases really speaks to the fact that we are a clinically focused course with an aim towards getting people into healthcare work in the future. Little bit of a word on virtual learning environment. So the Canvas virtual learning environment, which is one used by many universities around the UK, it contains all the information on the course. In each of the core modules, there's a week-by-week guide to work. And where we are doing webinars, these will be delivered on there, and recorded lectures will also be uploaded as links in the relevant weeks of the course. For each of the core modules, there's a discussion board, 1 per core module, in which you can have kind of asynchronous discussions with tutors. So that would mean that you can ask questions of the tutors about specific lectures or any other questions about exams and such like. Case-based learning also occurs, so I would suggest that you check Canvas week by week to see which topics have these. And these cases can be collected from your own practice if you're somebody who's working, or from the clinical sessions that you attend. And I would suggest where there is a case-based learning session that you practice presenting the cases during the sessions, because this is something that most clinicians have to do in job environments. And whether you're somebody who's practicing in medicine, nursing, physiotherapy, or an allied profession at this time, or whether you think you might go into that in the future, for example, as a healthcare scientist, this sort of practice is something that will stand you in good stead for the future. And because, of course, they're interactive, they give you the most chance to be able to learn from others on the course. We also have a few sessions which sit kind of outside the core modules. And one of the reasons we have this is that because our course structure is very much student-led, in the sense that you can choose your own optional modules to complement the ones that give the core learning about respiratory medicine. What we really want to do is bring that together so that we give you the opportunity to learn from the things that others have done. So we have specific sessions, 1 in semester 1 and 1 in semester 2, in which students will present to their peers to show what their optional modules have brought in terms of learning about the core outcomes. So an example for this might be a student who studied epidemiology in one of their optional modules might then come and talk about the principles of respiratory epidemiology, what they learned about epidemiological research, and how that helped them to understand some of the studies that they were reading during the core modules. We will also ask you to present, if at diploma or master's level, an outline of the project that you're doing for your master's presentation, or from a sort of summative learning of all of the optional modules. And that just gives you a little bit more ways of getting feedback on your presenting style, and importantly for those doing a master's, some feedback from their peers on whether or not their project is understandable, and whether they've covered all the bases that others would perceive from their optional modules that they've chosen, which could of course be different from their own. Across all of Birmingham sessions, there are personal academic tutoring, and we also have an academic skills component. There are central academic skills sessions offered by both the library and others, but we choose to offer some of our own in-house that we do once a fortnight, in order to target the specific academic skills to the types of things that will crop up across the course. Examples might include integrating multiple sources of information, such as you get within clinical practice, or how to demonstrate critical thinking within an essay. So these academic skills meetings are organised by the programme and are group meetings. But in addition to that, the personal academic tutoring system gives you some individual pastoral support from an academic tutor who you can go to when you wish to, although we recommend probably checking in at least once a semester to think about your individual academic progress and personal development, and thinking about things like careers, maybe getting references. Some of those things are things that your personal academic tutor may be able to help with. Earlier on, I mentioned that there are some formative assignments, and this is just to give you a little bit more detail about the topics that we focus on with the formative writing. Generally speaking, there are two linked to the community module, one on public health aspects of respiratory medicine and one on occupational lung diseases. Whereas in the secondary care module, there's a formative assignment on cystic fibrosis. The first two are quite short in their writing styles, up to around 500 words, whereas the secondary care formative assignment goes up to about 1,000 words, which sort of builds towards the idea that you will be writing 3,000 word assignments as the summative assessments later on. And those summative assignments comprise case-based learning in the community module and a service development plan in the secondary care module. We've already alluded earlier on to how the master's programme works. There's a project choice, so you choose from a list, or if you've got your own idea, get approval from myself or my deputy as the programme lead team. Supervision meetings will occur with your named supervisors. Sometimes these will occur once a month. I would certainly expect that to be happening during the phases when the project is most active. And there will be group meetings during either late semester 2 or the supplementary period according to student need. During the write-up period, group meetings can continue, but we will generally make these remote enabled, recognising that many students may wish to return to their home environments when they are purely writing up as opposed to being campus-based. However, where people are fully campus-based, there's no reason that we can't hold those face-to-face. And submission generally occurs in late August. Assessment comprises the written assignments that we've referred to before, the case studies and service or quality improvement plan. In addition, in the community module, there is a spirometry interpretation pass-fail assessment, spirometry being one of the key tests within respiratory medicine to both make a diagnosis and determine disease severity. The two core modules have different examination styles, with a multiple choice question exam, which is generally held in a computerized manner, but will be done in an invigilated environment at the campus, and a short answer question format, like a mini essay, so writing 500 words, say, per question for the secondary care module. This again can be done in a computerized way, but because of the nature of the exam, can be done remotely in a more easy way. There is an attendance monitoring system at the university, and we do require attendance monitoring for some of the sessions. In particular, the clinical sessions, we require you to document attendance at those so that we can see that you've got the adequate exposure to the clinical environment that we wish students to be able to see. Whilst there is attendance monitoring within the lectures, this is not as important as the clinical sessions, and varies according to the lecturers that are running the sessions. Generally speaking, there are two different places to go to if you've got questions about the course. The administrative team, whose email address is on the course webpage at the university, are the right people to go to ask about logistics to do with the course, dates of different aspects of the course, or where you have questions about something that's on Canvas if you're already a registered student. Myself or the module leads, who will be named also on the university programme pages, are the right people to come to if you've got academic questions. And so academic questions might include is my baseline qualification suitable for this course? What else might I need to demonstrate to be suitable? That type of thing. We can also give maybe a little bit more detail if there's specific areas of master's study that you wanted to know if we include. So more than happy to hear from people after this. I can see that, relatively speaking, attendance numbers aren't high at the moment, and I imagine some of you may well be catching up on this from the recording. So rest assured that we're quite used to receiving questions afterwards and in an ongoing way by email throughout the year. Just do bear in mind the end dates for applications to the course, and in particular that these may be earlier than you think if you're coming from abroad to the UK.